room and back to the island, our good friend Dr. Hoa Nguyen, the chairman of the Physicians Advisory Group. Doc, welcome home.
Oh, thank you, guys. Miss Guam.
Yeah, Doc. I mean, you picked a fine time to go on vacation.
And to come back.
Yeah.
Your cell phone bill must be through the roof.
I know.
So, Doc, you went to deliver your daughter to college, right?
Yes,
Right.
It's a very interesting trip, though. I mean, California, it's pretty much back to normal, and there's not much use of masks over there. So it's interesting.
It is interesting, Doc, because the governor, when she had spoken at the Economic Forum, had talked about maybe easing the mask mandate. But I think recently, last week, she came out and said that probably wasn't going to be done. And then more recently, I believe it was Monday, there was an announcement made that we could be heading to PCOR4 by Liberation Day in about a week. Doc, what's the discussion been like with the PAG relative to this?
You know, we are ready to go to PCOR4, but, you know, even the WHO and I probably CDC will follow soon, is that because of the surge of the Delta variants in the state, and we're going to expect there's a surge here too in Guam of the Delta variant. I think that as much as we're going to relax a lot of restriction, we're going to still recommend that for indoor in a public place, you know, we're going to still recommend the use of masks as mandatory. There's quite a bit of positivity in the community right now, and again, this is totally mostly on the unvaccinated population, where you see the family unit, the adult that unvaccinated bring it back and infect the children. And the Delta variant very unique to affect the young population and the children. You can see there's some children that already been to the hospital already. So that's what we worry about, is that, you know, with the school year coming up here, is that if we don't vaccinate at least 50% of the 12 to 17, we might have some positivity and some surge in the school. So the use of masks, even in August, we still recommend it indoor. Going to be mandatory for indoor. Outdoor, you can, if you vaccinated and fully vaccinated, go without the mask outdoor.
Yeah. Doc, so when you were in California and you saw how they were kind of doing it, because I think they reopened, I want to say it was in June. What can we take away from what they're doing now and figure it into what we're going to be doing when we go into PCOR4 or not doing?
You know, I see signs everywhere in California that they post everywhere that if you vaccinated and fully vaccinated, you don't have to use a mask, and if you're not vaccinated, you have to use the mask. So it's an honor system that they trust people and do the right things, and that's something that we can implement it here. We put up some sign. We're going to modify it for our island. But again, I really recommend that if you are not vaccinated, protect your family by using the mask in the public place. And we have a lot of family gathering. That's what we do, right? We love for family gathering. And if you're unvaccinated, I will keep your mask on, because, you know, you're going to get infected and you affect the family. And, you know, all the deaths so far that we have is all unvaccinated population.
And we've had I mean, you mentioned in the beginning, Doc, the number of positives we had in the last week. It's like, what was it again, Brie?
73 in the past 7 days.
Yeah, 73 positives in the last 7 days.
Yes. It's the number will go up. We're expected to go up because, remember, we relaxed a lot of restriction. But again, as long as the hospital admission don't approach the number, then the hospital can handle it. But, you know, we don't want people to still die from the COVID-19, right? We just have another death there that unfortunately patients not vaccinated. So we're going to keep a close eye on the hospital admission, and we decide which way we're going to go based on that. We're going to target some, population that that have a low vaccination rate, okay, to try to bring them up to at least 50%. As you can see, even the state that have less than 50%, the cases are going up. It's a sign, it's a number that we can see there. So we're going to need to bring those subgroup up to at least 50% to protect the whole community.
Doc, yeah, I mean, so we're quickly approaching the herd immunity, but it kind of looks like from what everyone is saying is that the positives and the hospitalizations are coming from people who aren't vaccinated. So is this just something that we're going to have to deal with? Because when we reach the herd immunity of 80,000, I'm assuming there's still thousands of people who just for whatever reason don't want to get the vaccine.
Yes, and we understand that, but there's also a large population out there that for whatever reason is they are procrastinating. So I think that they don't have a mean to get to a vaccination clinic. So we're going to change gear a little bit and go out there to the subdivision, to certain village, certain place, and do a smaller pots to try to get those people, to make it convenient for them to go out and get the vaccine. And that's how we're going to approach now in July. So for us, we're going to kind of shut down our Hyatt and Father Doinus, and we're going to go out in a small place and try to reach out those pockets and get the people vaccinated. So we're going to have to change gear a little bit to get this 20% or less people get vaccinated as much as possible.
Doc, I don't know if we can switch hats right now and go from you being the Physicians Advisory Group chair to the controversial Bill 112, which I know you testified in opposition to. You know, the tone of the testimony on Monday, Doc, outside of just a couple of, Dr. Berg, Dr. Shea, they're the way they are, right? But it definitely seemed like it was a different tone, and that there seemed to be a desire for doctors to sit down with the senators and kind of work this thing out. Is that accurate? Is that where you think we're at right now?
Yeah, it's really, again, we all fight for one thing, right? Seriously, it's number one thing for us is protect the access of care for our patient, okay? And that's all we're fighting for. It's not to protect the physician, nor protect our business. It's number one thing for our patient. And so, yes, we are willing to sit down and talk to the senator, including the speaker. I think that the bill was written, 112 was written without any consultation with the physician or the medical community at first. And that's the problem. The bill is out there without even talk to us. None of the physicians are involved in making that bill. So what we like to do is that, get rid of the Bill 112 and sit down and talk to the medical community, the healthcare community, and work out something to improve the quality of care for the patient. Now, you gotta understand, and I listened to a lot of patients that testified during that public hearing, and guys, you remember Bill 112 affect only the private practice to a community that really serve the majority of the healthcare. It does not affect the GovWarm facility like GMH or public health. And if you listen to all the people that testify there, most of the bad outcome, where it's coming from, the hospital. But even Mr. Lubowski was mistaken that the medical arbitration law right now protect the physician at GMH. No, they don't need the protection. They already have the GovWarm cap. You can't touch the physician at GMH. So the law, the Bill 112 actually doesn't change or doesn't improve the quality of care in Guam. Is really affect the practice which are doing very well and improve the quality of care one right now. It doesn't touch the bulk of the malpractice suit, which is at GMH. I hate to say that because GMH is part of our practice too, but you got to really understand where it's coming from before you change. So that's why I can say that, yes, we are willing to sit down and talk to the senator and come up with the way to improve the quality. And because right now, Bill 112 really don't do anything. It's just penalize the private practice, which is doing the best they can. And that's not where the lawsuit coming from. It's from the hospital. So they attack the wrong way. That's like,
Doc, what do you make about the argument though that the mandatory arbitration is too costly for patients who feel that they've been a victim of negligence or malpractice to pursue? Because we did see some doctors mention that they agree that it's just too expensive, and so there was some discussion about how do we lower the cost of arbitration and make it more accessible.
Any type of claims for medical malpractice are going to be expensive. It's not cheap to go to court, but arbitration relatively much cheaper than litigation in court. Arbitration is much faster. It's settled within 3 to 6 months. In court, it's going to take 2 or 3 years in court, and it costs a whole lot more. And the problem that if you go to litigation, most people will settle, and that's the thing. The physician never have a day in court. It's going to be in their database for a long time and affect their career a whole lot. Even they cannot have a chance to go to court. Just for example, you guys remember Dr. Rosie Villa-Gomez, a very young internal medicine doc many years ago, and she's so good for people in Guam. She had one lawsuit, which she won, but she's so frustrated, she moved off island. We lost a very good internal medicine doc. And that's what this bill gonna do, is that we're gonna lose a lot of physicians, and then our people don't have no place to go. So the arbitration is a way to kind of filter out all the claim that is not valid. So that's but again, Bill 112 does not fix the problem. Okay, the problem is at GMH, just like David Lebowski, right? I mean, he got settled at GMH, and there's a cap to it. Okay, and the physician is not named. Okay, but the private clinic, if you look at the thing, there's not too many lawsuits for private clinic, guys. This bill excludes GovOne facility, and Senator Talahi needs to understand it will affect the quality of care, but she approached it really a wrong way, because like I say, she doesn't fix the problem that they have. The GovOne facility is excluded. It's not touched, it's untouched. But the private side bear the burden for that one. So I would say that if you want the bill to improve the quality of care, which it should be, and not just the cost of arbitration or cost of litigation, you have to get rid of Bill 112, sit down with the physician and talk to us in order to improve the quality of care. That's all we want, right? So I just really hope that we can sit down at a round table, but Bill 112 is not the solution. It's far from the solution. And the public hearing, to me, I don't think they should have anymore, because really, it's really not solve anything. It's really a show, and it's a circuit, and that's a shame. So I think that the true thing is to not have public hearing, but sit down and talk to the community, the healthcare provider, and come up with a solution.
Well, Doc, we had the speaker on earlier this morning, and she did say that they're planning on roundtable discussions with smaller panels to include healthcare professionals. Doc, we got to run, but it was really good to catch up with you.
Okay. Thank you, guys.
Thanks, Doc.
Be safe. Okay?
Always. I'm still washing my hands, Doc.
Okay, Chris.
Okay, Doc. See you. There you go, Dr. Hoa Nguyen of the Physicians Advisory Group, also of American Medical Center. It's 9:18. Quick